This timeline starts when Trump took office in 2017. Here we have the Obama-Trump admin pandemic exercise. This is an exercise that they ran while changing from the Obama to the Trump administration. A pandemic could become as bad as the 1918 so-called Spanish flu or American flu. Trump takes office. Trump was briefed about the pandemic playbook. Bill Gates on this day said, "We are not prepared." He also urged pandemic prevention. Fauci warns of a new or reemerging infection in this administration.
Without a doubt, we are going to see some either new or reemerging infection in the next year or two or three or four. But if history holds true, it certainly will happen in this administration, so we need to be prepared for it.
Here's a warning about the big one is coming, and when it comes, it will affect every human alive today. Here we have the Trump admin is ill prepared for a global pandemic. And then here we have the Director of National Intelligence reports novel or reemerging microbe, easily transmissible between humans, remains a major threat with the potential to kill millions. Business Insider, the next pandemic is coming. A flu pandemic is coming. Emphasizes ventilators and other preparation. Pandemic will come, quote, sooner than we expect. November 2017, Fauci says the biggest concern is an influenza pandemic. Trump administration may be woefully underprepared. A new pandemic is a matter of time. An influenza outbreak remains the scariest scenario in public health. The Director of National Intelligence says the potential for a severe global health emergency that could lead to major economic and societal disruptions. Bill Gates, again, U.S. is not prepared for pandemic. National Security Council Director of Medical and Biodefense Preparedness says the threat of pandemic flu is the #1 health security concern, and the U.S. is not prepared. 2 members of Congress say the United States is vulnerable to pandemics. A senator urges Trump to prepare for the next pandemic threat. U.S. is not prepared for pandemic. An influenza pandemic represents a real threat that could only be managed with a rapid and effective response from both national governments and the international health community. The U.S. is not ready for the next pandemic. The U.S. should commit to pandemic preparedness by creating a position of authority within the White House that transcends administrations and elevates pandemics as existential threats to a national security priority. We are not prepared. A global pandemic response simulation was run. Another global pandemic response simulation was run. And this one, the ILI, the influenza-like illness, was actually from China. Here, the WHO says the question is not if we will have another pandemic, but when. We must be vigilant and prepared. And this here is the earliest time that COVID-19 has been suspected, which is March of 2019. March 12th is when some water samples were taken in Spain, which were later found to have the virus that causes COVID-19 in them. Because this would throw off the entire timeline, it has a very heavy burden of proof, so it needs more confirmation, obviously. But just so you can tell in this timeline, potentially the outbreak had already started that early. We're due for a flu pandemic. Hoover Institution highlights challenges with pandemic preparedness. Harvard, be more scared of pandemic unpreparedness. We must prepare for the next pandemic. Another warning. The world is at acute risk for devastating regional or global disease epidemics or pandemics that not only cause loss of life, but upend economies and create social chaos. Risk of a global pandemic is growing and the world isn't ready. The next global pandemic could kill millions of us. Experts say we're really not prepared. Pandemic is coming, but nobody is interested in doing anything about it. The next pandemic will be arriving shortly, and then the Crimson Contagion results are released. And the results are 110 million Americans were expected to become ill, leading to 7.7 million hospitalized and 586,000 dead. They also highlighted a need for increasing hospital beds and overcoming a shortage of ventilators. Presidential candidates are ignoring one of the world's biggest looming threats. And then Wuhan military game starts, and we have Event 201, yet another simulation. And another warning, deadly pandemic could sweep the world. Right here in late October of 2019 are the earliest reports of people at least claiming that they may have been sick with COVID. So we have France, Italy, and Spain all having people that are claimed to have been sick at that time. Brazil. Here, apparently, the US was warned multiple times about a contagion in China, though it's an unsourced claim, so it's hard to verify that. the pandemic simulation exercise spotlights massive preparedness gap. Around here is when the New Jersey mayor said they may have been affected. Other than the one-off discovery in Spain in March of 2019, and the claims of people to have been potentially infected in October, and several other potential cases in November, this December 1st case in China is the first more or less confirmed case. And then the previously suspected first case was here on the 8th. The first case that had anything to do with the market was here on the 10th. So we know it has nothing to do with the market. Forbes, we are woefully unprepared. And Forbes also says that the first potential US case was here December 22nd, 2019. The virus from Wuhan was uploaded the 24th of December. So this is the first time that people in the international community had access to the virus information. That's the 24th of December, 2019. The 26th of December, this is when Dr. Zhang noticed the situation with her patients, and it began the whole process of getting things going in China. The first international warning of any kind other than the virus being uploaded from China was this ProMed notification, which happened on the 30th of December 2019. The following day, the WHO was notified and the international community was aware that there was a disease outbreak happening in China. The first known case in the United States is January 7th, which we didn't know about at the time. On the 10th of January, the WHO says healthcare workers should assume the potential for respiratory spread. They also say in their guidelines that specimens should be regarded as potentially infectious, and medical workers should wear masks, goggles, and gowns. So the CDC and the WHO are, as of January 10th, both recommending that medical staff wear masks, okay? So they are both well aware of the concept of masks and what masks do. What they may not know at this point is that the virus is airborne. So it makes sense for them to recommend that medical staff wear these things, but not necessarily that the general public does. On January 14th, everything changes. The WHO says China coronavirus could spread, quote, "It is possible that there is limited human-to-human transmission." As of January 14th, every single medical professional in the world is aware of the fact that it may be possible that there is at least limited human-to-human transmission. Reuters reported, "New China coronavirus could spread, warns hospitals worldwide." They also said there is risk of a possible wider outbreak. And they refuse to rule out human-to-human spread. And they also say, quote, "limited human transmission between family members," and that risk of wider human-to-human transmission should not be regarded as surprising. The next day, World Health Organization, quote, "there may have been limited human-to-human transmission." And the Wuhan Health Commission says human-to-human transmission can't be ruled out, and they expose a potential case within the family. Live Science reports new SARS-like virus in China may spread between people in limited cases. The CDC says, quote, "there is some indication that limited person-to-person spread is happening." That's the 17th of January, 2020. The 18th, the HHS secretary warns Trump about virus. Trump calls him an alarmist and interrupts the conversation to ask when vaping regulation will be lifted. On the 19th is what people at the time thought was the first case in the United States, even though there had been cases for at least several weeks, potentially even a month. And the WHO says that the global risk is high. White House Domestic Policy Council warns the virus is, quote, "likely to dominate life in the United States for many months." Former Trump admin writes an op-ed that says, "Act now to prevent an American pandemic." U.S. Army infectious disease expert says, quote, "we should treat this as the next pandemic." New York Times article, "we must do everything we can to contain and extinguish this outbreak before it becomes a devastating global pandemic." Trump is warned, quote, "this will be the biggest national security threat you face in your presidency." WHO, "whole world needs to be alert now. Americans defenseless in the case of a full-blown coronavirus outbreak on U.S. soil." January 30th, symptom-free transmission is possible. Reinfection is possible. Tests can fail several times. The Atlantic says we don't have enough masks. WHO declares a public health emergency of international concern. Human-to-human transmission in the USA is confirmed. Wall Street Journal says pandemic seems inevitable. Then we learned that it can have a very long incubation period in some extreme cases. We also find later that this was the day of the first known American death from COVID, February 6th. And this is the same day that Trump tells a reporter that he is aware that COVID is more deadly than the flu.
It's also more deadly than your strenuous flus.
Is transmissible in air.
It goes through air.
And has a 5% death rate.
This is more deadly. This is 5%.
Aerosol transmission is indeed possible. The former head of the FDA warns Congress medical supply chain issues. Trump delays the U.S. worldwide threat assessment indefinitely, which was expected to warn that the U.S. remains unprepared for a global pandemic. They say it's possible, even likely, that community spread may eventually happen. In reality, of course, community spread had already been happening for somewhere between a month and a half to 2 months. There's a memo that says increased probability of pandemic that could infect 100 million people and could kill 1 to 2 million people. Fox says there's global pandemic fears. Harvard professor says it will likely not be containable. Dr. Helen Chu finally just tests the patients against the government's support. And surprise, they have COVID-19. The CDC also warns that disruption to everyday life may be severe. And this is the day that my video came out about the H1N1 and what would happen if the coronavirus hits the United States. WHO says the global threat is very high. FDA reports drug shortages. HHS says the US has only 1% of masks needed for pandemic, which is quite strange because if we believe any of the other stuff they've been telling us, we don't need masks. In fact, we should probably just be burning masks because they only make things worse. The vice president tells the public there aren't enough tests.
Working in partnership with our commercial labs, we're confident that we're going to be able to address that within a matter of weeks and begin to distribute coronavirus tests much more broadly across the country. We don't have enough tests today to meet what we anticipate will be the demand.
The government is reported to be debating how, quote, far to go in telling Americans the truth. And Fox says we still don't have the testing. The global pandemic is declared, and the CDC admits that they've misdiagnosed COVID deaths as flu deaths, but they offer no details such as how many, when, where, nothing. The HHS says supply chain and transportation impacts will likely result in significant shortages, and the New York Times says 1.7 million people could die. On March 16th, a study says 2.2 million US citizens might die from COVID. The Atlantic says that cases are in an exponential curve. U.S. active cases surpasses China. Trump tells a reporter that it's dangerous to young people.
Now it's turning out it's not just old people.
And I wanted to play it down. I still like playing it down. I don't want to create a panic.
I wanted to always play it down. I still like playing it down because I don't want to create a panic.
WHO warns that the pandemic is accelerating. The United States becomes the #1 in cases. LA Times says groups are causing spread and deaths. Scarcity of ventilators has become an emergency. Here's a warning that up to 240,000 deaths may be possible. Somewhere around this time is when the amount of deaths from COVID was about half as much as the amount of seasonal flu deaths worldwide in the same amount of time. United States becomes #1 in deaths, and around this point is when there were as many deaths as seasonal flu. And then there's deaths in all 50 states. Over 1 million cumulative cases, over 1 million active cases. 100,000 people are dead. And right around here is where we reach about double the deaths of the seasonal flu for the same amount of time. Despite warnings, the US wasn't prepared with masks for coronavirus. Now it's too late. And this is absolutely correct. By June, it's just way too late. There's really nothing that you can do anymore. It's going to be a full-blown, fully hitting pandemic inside of America because there really hasn't been any action other than confusing everybody and telling them not to wear masks and telling them all to gather and everything's going to be fine, and then eventually shutting things down but then quickly opening them back up. So USA Today is absolutely correct. It's way too late as of June.